One thing that to me, this is the second topic I want to talk about is hospitals for each patient. Hospitals are, for the fortunate, you don't need to go there. Majority of patients don't use hospitals. I would say only about 5% of the population, mostly seniors, unfortunately, do use the hospital a lot more than the rest of us. And hospitals are usually for investigative procedures like X-rays, CT scan, MRI, invasive things that to help to diagnose, and procedures that has to be done within the hospital like surgery. And these are things that outpatient most people cannot monitor and do. So they have to be in a confined environment that is safe for the patient to go to, because they provide the up-to-date technique and the care that is vital for the patient. So it's a controlled environment. That's what a hospital is. So surgeries are done there. You recuperate inside the hospital, then you are sent outside post-operatively. Now, hospitals are not all equal. So hospitals are graded every year, and some hospitals are very proud. Oh, I'm in the top 20 in the United States, I'm in the top 10, and you will find that they do advertise that how well they are graded. And of course, most of us will only want to go to the best if anything happens to us. But not all hospitals are good in everything. They may be good in surgery for one type of surgery, and they may not be any good in others. Okay, so when they are graded, they're graded overall. And if you have 10 different procedures, the hospital is being graded, and if they come out by, grades or scores at a certain level, they are included or excluded. So these are done by business people, people in quality care, and they are a selected group of people. It's almost like, although different, but like consumer's guide for any product. They go in and they test it out and find out who complies, who are the best quality, and then you get that silver star or that gold star. And I think in some ways it's good. It gives you an idea that the hospital you're going to is relatively safe and well respected. Of course, a lot of teaching hospitals are in that category, and but it doesn't mean, the name itself does not mean that they are all good in everything. Okay, so I think that's for the individual to seek out whether your doctor who works there with that specific department, that particular procedure is considered good in that hospital. Now, the other thing is cost. I mean, if an insurance group does not allow you to go to that hospital, even though they are the best, because they are so cost prohibitive. Meaning to say, if they do an X-ray for you, whichever part, it could be your hand, your neck, your arm, legs, whatever, their cost is 3 times, if not 10 times, as much as somebody in outpatient who can do the same thing for 1/6, if not 1/10 of the cost. Now, insurance will say, why would I want my patient to go to somewhere so costly? So obviously they would say, well, sorry, you belong to this health plan that we don't take this hospital. So you're at the mercy of the insurance group who dictates and tells you where you can go. Now, that's a huge burden to a lot of patients. And in my years of practice, a lot of my patients have ended up with bills that they did not know about ahead of time, because the hospital didn't tell them, your insurance we don't take, and so they end up with a bill that's way above their estimate. Okay, so if you have a deductible of $2,500 and you're 26 and above, 26 and above, you're going to end up paying that $2,500. Okay, going to an emergency room, the minute you walk into a private hospital or at most hospitals, you're down $500. Okay, so anything they do, whether hang an IV, do a blood test, you're easily over $1,000 when you come out. And I don't know too many people who come out of an emergency room less than a couple of thousand. Okay, even for cough and cold. All right. So I think it's very important that hospital that you go into, they will treat you if it's an emergency, no problem, because it is something that they're obligated to do is take care of emergencies. But the cost comes afterwards that you don't know about is something that's going to be shocking to you in your wallet. Okay, so hospital then is make sure the hospital you go to is something that your insurance will cover. Check that out. Aside from emergencies that they will in the entire nation, they will take you in, but the cost that you have to pay afterwards is not determined because they don't know how much they're going to do for you when you're there. So the tap is going to be kind of a open tap. Now, hospitals also have different qualities aside from what procedures they do best. Your doctor, I think, who works with that hospital will probably know best as to which hospital they will send you to that they feel safe and comfortable with because they've worked with them throughout the years. So a majority of doctors will only work with 1, 2, or 3 hospitals at most because they have a relationship with that hospital. So it goes with the territory of picking your doctor as to which hospital they go to. You may like a certain hospital because they're closer to home. You may like a certain specialist because they are your friend's doctor. Now these have to be determined, unfortunately, even before you get sick. Now how are you going to know? You're going to have a heart attack, or you're going to have a problem with your anemia or menstrual problem? You don't know until the time comes. So there's no fail-safe when it comes to referral to where and when. And a lot of hospitals that are notorious for being good, but you can't get in. You have the wait period of 3 months or more. And if you have cancer, you don't want to wait 3 months. You know, so I think it's something very important that the system you choose, you have to know how well they operate. Now, for majority of people healthy, it doesn't matter because you say, well, I'm healthy, nothing's wrong with me, I don't expect to get sick. So you pick the hospital within your network, everything's covered, and everything, meaning say everything you know is covered, because there are always exceptions to the rule, and unless it's an emergency. So you never know until something happens to you. Okay, so it's kind of a wild guess, and it's very few people aside from if you're Medicare. Most of the time you are covered, most of the time, but you have to have a secondary insurance to cover that. Medicaid pays for 80% what happens to you, but that's 20% is out of pocket unless you have a secondary insurance that takes care of that 20%. Don't forget. And so insurance is a tough area to go into. I have to defer that to another time. But hospitals are, are graded. The quality care is very important to know. Ask your doctor, and make sure they don't have any money affiliation with that facility, because that can sway their opinion as far as where you should go.